really have been pleased with our Surgeon General issuing warnings. The social media, he actually said, is the biggest threat, public health threat facing kids in our nation. And I agree with that. And having the Surgeon General say that, and then even calling on Congress to say, we need them to put warning labels. I always say to parents, this device is a tool, not a toy. Start teaching your kids this at a very, very early age.
I was spending a lot of time looking at the bikini advertisements. They decided that the best option to keep my engagement was to show me more of those bikini advertisements. So it took over my entire feed. My algorithm started showing me more and more of this eating disorder content. And I went down the rabbit hole because this content was very engaging to me. And I began seeing only this content. Now, that was really dangerous for me at my young age because I didn't know that social media wasn't representative of the world. So I began to change my behaviors and my habits to look like these women in these photos. And I began to follow the diets that I was reading about on Pinterest. I began to follow the exercise routines and the workout routines that I was following on Pinterest. This content followed me onto Instagram. It followed me everywhere I went on the internet. I was a child who wanted to fit in and who wanted to be liked by her peers, and the internet was telling me that this was the way that I was going to be liked by my peers. So it led me to many, many, many years spent with an eating disorder that I was only able to find help from after I deleted my Instagram accounts and after I completely removed myself from these online environments, which is incredibly unfair because I was a teenager. If I wasn't on Instagram, I wasn't talking to people. So I had to make the conscious choice. Am I going to prioritize my physical and mental health and be healthy? Or am I going to continue engaging and being social with my friends like teenagers should?